named Tarvin. I'm 30 years old. I was born and raised in Perryton and went off to college in Amarillo Canyon area. And I decided to come back here to be close to family and take care of people that have invested in me my whole life. When I was little, I grew up dancing and I thought that that would be the best job in the world. While I enjoyed dance, and I still do, I knew that it wasn't a feasible career path for me. So in college, I kind of took my time figuring out what I wanted to do because I didn't want to end up in the wrong field and absolutely hate it. So I kind of took some classes and fell in love with probably the hardest respiratory class there is, which is respiratory pharmacology, learning about all the drugs. Respiratory therapy is critical in the hospital because most people see us putting oxygen on people or doing breathing treatments, but it goes so much deeper than that. We draw people's blood to see how well their lungs are working and whether or not this patient needs to be intubated with a ventilator breathing for them. Not that that's always fun, but that's what we do and that's what we enjoy doing. There's been several instances where people I know have had heart attacks and they walk in a week later from Amarillo having a stent placed or whatever the case might be, and they come in and thank us. And not that it's about the thanks, we are just glad to see them up and moving and breathing and smiling at us. In high school, I would focus on taking dual credits. That's just going to speed up your process in college. And then if you think that you might like to go into the medical field, see if you can shadow somebody locally. The good thing about it is there's so many different aspects even within healthcare for respiratory therapy. There's respiratory therapists that work at the hospital. There's respiratory therapists that work in a cardiopulmonary rehab, or there's home health respiratory therapists. There's just lots of different avenues even within one career path that you can take. We are there for the baby's very first breath and helping them if need be, and we are also there for our elderly patients' last breath. And it's very fulfilling either way. You look at it, you kind of get to see the full circle of life in a rural community like this.